Talk about eye floaters. What those are, how common they are, what changes are happening in the body when we get those.
Yeah, so floaters is a common thing that people experience, and I get a almost most of my patients that come into the eye clinic, I will see some level of floaters inside the eye, especially as they're getting older. Floaters basically are a change to the gel inside of the eye. There's two fluids inside the eye. One I mentioned earlier called the aqueous humor. That's in the front part of the eye. It's kind of like the blood of the eye, except it's clear. In the back part of the eye, there's a gel called the vitreous humor, and it more or less holds the shape of the eye. Uh, that gel is mostly water, but it has a little bit of type 2 collagen in it. And that type 2 collagen, as you get older, it starts to degrade. Again, like your skin on your face starts to sag, this gel starts to degrade as well. And the gel, whatever's left of the collagen, these proteins kind of clump together and they sit inside of what's left and they drift back and forth. And if you're in a really bright lit room, like for those of you who are watching the video feed from like YouTube or something, like the sun is now hitting the side of my window, so it's like suddenly the room seems super bright. But when you're in a bright room, or if it's like a snowy, if you ever live in a place with a lot of snow, or if you're looking at a bright background on a computer screen, you may see these little black hairs or cobwebs or little spots drift around back and forth. So that's actually those collagen clumps stuck inside the gel inside your eye, and the light is casting a shadow that hits that collagen, that protein in it. You're seeing the shadow scatter across the back of your eye. So that generally is what floaters are. And since it does have a relationship to aging, we basically see about a 10% increased risk of having these floaters per year of life. So if you're at age 50, you have a 50% chance of probably having these floaters. 80, there's about an 80% chance. There is a moment in around middle age to maybe 60 some years old where the gel often fully peels away from the back of the eye because this gel is in touch with the retina in the back of the eye. And as the gel starts to separate, it can tug either on the retina or it detaches from the optic nerve in the back of the eye. And then people come in, they're like, I'm seeing sudden, huge amount of floaters. I see this large floater in my vision now, this huge black spot drifting around. And that's usually when this vitreous cortex, or this outer layer of the gel, peels away from the retina. And 95% of the time when that happens, that's all it is. The gel peeled away. But there is a risk that when it peels away, it can tug on the retina, and it can either create a tear in the retina or a hole. And if that happens, the fluid that's inside that space of the vitreous humor can seep behind the retinal tissue and lift the retina tissue off the back of the eye and create what's called a retinal detachment, which is an ocular emergency because a retinal detachment can cause blindness and permanent vision loss. So for anybody who's having sudden, little small floaters is not a huge deal. That's pretty normal. But if you have a sudden change in floaters, if you see flashes of light, because as the gel peels from the back of the eye, it can kind of mechanically stimulate the retina and create like this symptom of a flash of light. Or if you have any loss of vision, then definitely do not hesitate. Call your doctor, make an appointment right away. It's kind of a sad joke in the eye care industry, but we always get someone who calls on a Friday afternoon at like 4 o'clock, right before we're about to close. And they're like, hey, I got to be seen right away. My vision's going bad. When did this start? Oh, like 2-3 weeks ago. It's like, when you're having these symptoms, do not let it go. Just give us a call. We'll make an appointment. We'll get you seen right away. The sooner we catch it and get you sent over to surgery, if that happens to be the case, the better chance of you not having any permanent vision loss or damage. So that's kind of my tip for everybody. If you're seeing these changes, do not sit on them. Get seen just so you can get things checked out, at least for the peace of mind.
And in that case where the gel is actually peeling away from the back of the eye, what will you do with the patient?
So if the gel is fully peeled away from the back of the eye, assuming that nothing has torn, there's no holes, there's no detachment. Usually that's all that needs to be done. It's like, hey, it's fully detached. Awesome. No real risk. There is a small risk that it could still develop within 4 to 6 weeks after the initial experience. So we'll do some testing to make sure that there's no swelling or fluid development within those 4 to 6 weeks. But after that, there's really not much we do. We just say, hey, you've got some severe floaters. Most people neuroadapt or get used to seeing the floating spots. And that takes maybe, the research shows about 6 months. It'll take about 6 months to neuroadapt. You just get used to it. Yep, the floaters are fine. They're not a concern. They're just there. However, there are some surgical procedures to remove floaters. We have one called laser vitreolysis, which doesn't 100% get rid of floaters, but they use a YAG laser to zap. It's like playing Asteroids, the old video game from the 70s, where they zap away the floaters with this little laser. There is a more invasive procedure where your retina specialist has to go in and drain the fluid of the eye and replace it with a substitute. That will get rid of all the floaters, but it carries a higher risk because you're going into the OR, you're cutting open the eye. The procedure risks are, I haven't seen updated studies, but a few years ago I was reading into it, is around 2% risk of a bleeding of the eye or having a retinal detachment. So it doesn't go without risk. And if you haven't had cataract surgery, having this type of floater removal, it's called a vitrectomy. Having a vitrectomy will induce cataracts because you're removing the gel, and the gel also has some supportive benefit of providing antioxidants to the back of the lens. So those are some risk factors, and why most surgeons, most eye doctors don't recommend surgery to remove the floaters. There is a supplement that came out a few years ago that has some research to support that the supplement may be able to improve this presence of floaters. And I did a video on this, the only thing, and I know I'm actually friends with one of the researchers. The only thing is that there is some conflict of interest in that research. If you look into it, they happen to have, that there's some patent or they own stock in the company that also manufactures the supplement. So, it doesn't mean that the study or science is invalid, but it does. I think the eye care industry still raises an eyebrow at it, and we would like more independent research before I think the other doctors and clinicians will start to recommend it or accept that research more.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Diabetes affects the eyes significantly. Not only does diabetes increase the risk for things like cataracts, diabetes affects the blood vessels throughout your body. And the retina in the back of the eye is one of the most highly vascular organs in your body.